You're live. All right, good morning. It's May 15th and this is Senate Health and Welfare. We're looking at a bill that's returned to us from the House, S-189. And Jen, maybe take us through the differences or what.
Yes, so I'm Jen Carvey, Office of Legislative Counsel. I have a markup version I did for you so you can see the changes in context. It looks like a lot and to some extent it is, but they also kept some of what you did. So if you remember, I wanted to see that too. So if you remember, the S-189 is an act relating to establishing a process for reducing or eliminating hospital services. You've had a hospital would provide information to the public, to the legislators, also to the Agency of Human Services, which would provide a non-binding recommendation, and then the Green Mountain Care Board could decide whether it was going to do anything about the budget. Many more conversations happened between when this bill left your committee and upstairs, including stakeholders getting together and trying to come up with a process that they could all get behind. So I think that's where we have landed here. And so one of the big changes is that we're only talking about eliminations. Hopefully I choose to say eliminations. So only eliminations and only certain services trigger a big process, but it creates this kind of confidential pre-process where a hospital that's thinking about eliminating a service can meet confidentially with AHS and Green Mountain Care Board and Healthcare Advocate to try to see if there's another way to address whatever the problem is that doesn't involve eliminating a service. So if a hospital is considering eliminating any of the following services, they have to provide a preliminary notice of intent to the Agency of Human Services, Green Mountain Care Board, and Office of Healthcare Advocate. You'll see it in subdivision B, but the list of services that trigger this mandatory preliminary notice of intent are emergency department services, primary care services, including closing a site where primary care services are provided, obstetrics, perinatal care, inpatient psychiatric services, treatment for substance use disorder, including medication for opioid use disorder, dialysis, including closing a site at which dialysis services are provided, or inpatient pediatric services. So if they're going to eliminate any of those services, including for primary care and dialysis, closing a site where those services are offered, then they shall provide a preliminary notice of intent. That's important because you're going to see a may on everything else. That notice of intent to be provided by the hospital would include the rationale for the proposed elimination, the financial impacts on the hospital, both of keeping the service and eliminating it, and a description of all possible alternatives to the proposed elimination that they considered and the reasons that they didn't pursue those.
We did have some language like this, but this is.
We're going to see. So yours is all in here with strike throughs for what you took out. And for what they do.
I got it. Okay.
So we're so far it's all pretty much new.
Yeah.
Because it's a whole preliminary notice. So
the preliminary notice, I was just talking about the information being provided.
yep. So you'll see.
Okay.
Yeah. The Agency of Human Services will evaluate the information provided by the hospital, financial impact of the proposed elimination on the healthcare system, and the impact of it on access to healthcare services in the region. The region can be a small region or a large region, depending on what the services are and where else they're available. Then it allows the Agency of Human Services and Green Mountain Care Board, right? No healthcare advocate here, may consult with a hospital that has submitted a preliminary notice of intent regarding the proposed elimination in order to explore opportunities to maintain the service or otherwise address the circumstances that prompted a hospital to propose eliminating it. And then it allows a hospital that is considering eliminating any service other than those in that list at the beginning of the bill may choose to provide a preliminary notice of intent to the Agency of Human Services and the Green Mountain Care Board that includes that same information about why and what else they considered. And they can also choose to engage with the agency and the board in the consultation process. And then it provides confidentiality, all information and materials related to a preliminary notice of intent and related consultation, including all materials provided to the agency or board, is exempt from public inspection and copying under the Public Records Act and kept confidential, except it can be shared with the Office of Healthcare Advocate, who cannot further disclose it. And then if a hospital chooses to go ahead, and so I'll pause here for a moment. So a lot of the discussion upstairs, and particularly from AHS and the Green Mountain Care Board, is wanting to encourage hospitals to be candid, to be upfront, to have conversations, whether in the context of hospital transformation work or broader healthcare transformation work. Wanted them to really be able to talk to the board and or AHS about what's going on and explore possibilities before the public gets spun up about something, or providers leave, or they can't try to recruit new providers because the rumors out there that a service is ending. So that's kind of the rationale for having that confidential preliminary process.
Do we know if all the parties are okay with this language?
So this was developed in consultation with them,
Okay.
so I believe, I don't want to speak for them.
Okay.
I encourage them to come tell you if they are
I'm
not.
trying to,
So I like this changes so far.
I'm okay with it. I just
Just
want to
like-
make sure.
Yeah,
everyone
no,
is-
I agree with you, but at least
Yeah.
it's getting out ahead of it
Right.
before.
Yeah, exactly.
Right. So then if a hospital chooses to proceed with the proposed elimination after going through the processes in subsection A, then within 90 days after the hospital provided the preliminary notice of intent to AHS and board, or upon conclusion of the confidential consultation process, whichever occurs first. So there's some, some urgency to working together. The hospital shall, and this is where we start to pick up some language that came over from the Senate, shall provide a notice of intent. So we had the preliminary intent, now we've got the notice of intent that they're planning to move forward with this to the Agency of Human Services, Green Mountain Care Board, Office of the Healthcare Advocate, and the members of the General Assembly who represent the hospital service area. This timing piece gets picked up in the next part, so it's still there, that the idea of not less than 60 days, but it moves. And that notice of intent must adhere, yes, as you passed it out, must explain the rationale for the proposed reduction or elimination. Oh, it should just say elimination. I took out all the reductions. They took out describing how it's consistent with the statewide healthcare delivery strategic plan once established and the community needs assessment.
So are you taking the word reduction out?
Yes, it's out in the real one. I keep finding this. I do these quick markups and I miss words,
So
but
just
yes.
see elimination.
Yes, so yes, and I had searched in the document to make sure, in this document to make sure that the reductions are all out. Let's just make sure, yes.
And you may have mentioned this, Jen, sorry, I possibly phased out for a few minutes, but are all, so reduction is no longer contemplated. in this
Reduction is no longer contemplated. There was such disagreement about what constitutes a reduction and who determines and what triggers, and
Okay.
that they went with elimination, and they went with elimination of a set list of services that really triggers all of it.
Thank you.
All right, so they provided notice of intent. And that notice of intent would explain the rationale for the proposed reduction or elimination, but not talk about strategic plans and community health needs assessments.
Yeah,
So that comes out.
I just read reduction again, but that's coming out.
Yeah, that's the one. Yes, that comes out. It's the same one I
It's only
read.
elimination.
Only eliminations.
Got
Yes, consistently throughout. I forgot to strike one purpose. Set forth the proposed timeline for the proposed elimination and a transition plan must be provided not less than 60 days prior to the effective date of the proposed elimination. So that's the same concept up here, not less than 60 days. Must be posted on the hospital's website. And it must still be published in a newspaper of general circulation. Nobody had a better approach than that for now. And then in addition to the notice of intent, the hospital must conduct a public engagement process. Again, this is really limited for the most part, except for the confidential consultation that is voluntary for the other services, to that list of services. I think there's concern among everyone about having everything that may be happening in the next many years around hospital transformation have to trigger a whole process. So in addition to the notice of intent, the hospital still conducts the public engagement process. The timing part doesn't happen before the notice of intent because of the new process that's laid out. But it still must continue for not less than 30 days following the notice. And the hospital would still provide a summary of the community's response to the proposal, including public comments. And it expands, so they provide them to not just to Human Agency of Human Services, but to the Green Mountain Care Board and the Office of Healthcare Advocate. Then it takes out the Agency of Human Services analysis and the non-binding recommendations of any sort. The Agency of Human Services was quite firm that it did not wish to make a recommendation, although we'll be doing the analysis earlier in the preliminary notice of intent stage. And then they kept language saying if the hospital chooses to go ahead with eliminating the service, one of those listed services after going through all these processes, then they would still be notifying the Agency of Human Services to inform the agency's health system transformation efforts and the statewide healthcare delivery plan, which you had referenced earlier. So I had shortened the name, but here it's the first time it's mentioned. And the Green Mountain Care Board, so the board can review the impact on the hospital's budget. Section 2 is the Green Mountain Care Board budget review. And just like in your bill, it still strikes the process that was established in last year's Act 68, carries through the changes about not talking about reductions, having references to both processes, and has the board impact the review the impact of reduction. It'll still be the one, yes. Still no reduction. Sorry, I did this quickly before.
No,
This morning, it's all limited.
I don't know. how-
Everything's limited. And then the board can adjust the hospital's budget as necessary to eliminate the to reflect the elimination, which may include directing that any savings related to the elimination. And then they took out the language about return to Vermonters to address affordability concerns. Nobody was quite clear on what that would look like. But they liked the idea of having it reflected in health insurance premiums or being reinvested in primary care prevention and other community-based services. And then there was a request, I think, from both the FR and the board. Nobody could quite remember why last year the board was directed to collaborate with the Department of Financial Regulation to monitor implementation to determine of any service. So DFR was taken out and it would still require the board, Green Mountain Care Board, to monitor the implementation of any, it's not an authorized decrease, it's just any elimination of hospital services to determine its benefits to Vermonters or the healthcare system, or both. And they changed the title to an act relating to establishment process for the elimination of certain hospital services.
With agree. The board shall monitor the implementation of any elimination of hospital services to determine its benefits in Vermont. I'm not.
I think this all carries from this, upon receipt of notice about an elimination, then review of the budget.
I'm just wondering whether or not the board has that capacity to do that and how they're going to calculate. I don't know.
Yeah, it's an interesting question. I think there was, when this language, most of this is from last year, and there was interest in making sure that if the service was being, in that case, reduced or eliminated, what's the impact?
I don't know how they're going to calculate that. I just,
Well, it'll be in the budget review, it may be in their, quality, analysis that goes on with the board itself. There's information that goes to the board about claims, edits and other things. So it will be up to the board how they do this. Some services are significant in the other thing is the board does have a responsibility to work with AHS on the health, HRAP.
now you're helping me because I thought they're going to care board look at rates.
They do hospital budgets
Yeah,
and they do rates.
yeah.
And so they do both of those.
But they don't, okay, they don't,
And they also look at, they have broad
they do. okay.
responsibilities. Yeah, and Act 48 gave them everything. And so
Okay.
we're trying, as we go forward, we're trying to look at it. What exactly should the board be doing as compared with AHS?
That's,
And we
Looks
do,
like
there
one.
is language, and I forget which bill it's in. I think it's coming back to us from the House. Yes.
does DFR play a role in this? Should they play a role in
Well,
this?
they play a
That's
role.
why they were taken out, is that in that particular piece, the parties all felt it was not appropriate for DFR to be referred to.
Okay.
So they would.
So, I mean, this probably isn't the last time we're gonna see service elimination in here, if you're here. And so, you know,
Yeah.
I just think it's very difficult to figure out, because if you eliminate a service, let's just hypothetically say in up to Newport.
Yeah.
Hospital, right, say, or you lose dialysis.
Yeah.
You know, there's,
So I think particularly through the all payer claims database, BCures, there may be some ability to look at whether when claims for a service, you know, went away from one hospital service area, where they pop up.
So that triggers me to another question, because at some point down the road, I believe, it's gonna be looking at eliminating some institutions perhaps, or nice hospitals potentially. And I've asked like JFO, can you calculate that? And JFO says, no.
Calculate what?
What's the impact?
You know, the loss of a whole hospital.
Yeah. What would the impact be? I don't, so the reason I'm here, or they didn't calculate.
so remember something. Initially, there's a confidential process.
Which I like.
So the board is getting all of that information
Okay.
along with AHS and the healthcare advocate.
And from the hospital.
And yeah, the hospital's responsible for that stuff.
Yeah.
So the hospital will, at some point, as we learned from the Rutland experience with pediatric beds, the hospital needs to negotiate with other services and other entities to ensure that pediatric beds are available, how we're gonna do it, how many.
There is a transition plan here as well.
That makes it
So
feel better.
there's, all of that is happening behind the scenes initially, and there's confidential information.
Yeah. Okay.
Then the next step is, okay, we're gonna change our plan, we're going to eliminate it, and we have contingencies so that people who live in Newport can have access,
Okay.
you know, within 20 minutes
Yeah.
or whatever. So that's envisioned. Then the board at the final step is looking at what's the hospital's budget look like? And what does the elimination of services do to their ability to be financially sustainable?
Right.
Right, so all of that,
Yeah, okay.
Yes, I think it'd be impossible certainly, you know, joint fiscal office wouldn't have the information needed to quantify what the impact would be. I'm not sure anybody can quantify that until it happens, because a lot of it is going to depend on individual behavior and utilization. And
I
what
agree.
happens with, you know, some of the hospital transformation discussion is around maybe not closing a facility entirely, but
Part of, exactly.
yeah,
And then
transitioning
moving it out
from
into
one type of,
Exactly.
you know,
facility.
from providing all services to
Yeah.
specializing in certain
Exactly.
services. So I think that this language about the board monitoring the elimination is really to make sure that that is being tracked as, you know, so that the impact can be, doesn't get lost in the shuffle, I guess, is.
Yeah, and all of this is avoiding some of the cataclysmic events that we saw related to dialysis and primary care closures, as well as pediatric beds. So I know a lot, there's some experience in here at the board with how to ensure
Yeah.
it doesn't cause an earthquake.
Small.
Yes, hopefully the confidential conversation earlier on can avoid.
Fourth point, we need them.
Yeah.
How are we feeling? Are we gonna concur with their change?
So committee, yeah, that's what I asked you. I think they've added that confidential section and they've made some modifications to the process that we had in there. They haven't really taken away the public engagement process that we thought was important.
No, they like that.
Yeah, that's.
They like that. There was a lot of discussion.
Yeah, no, it's good.
Among committee members. and things.
Overall, I think it's an improvement. It allows for some negotiation. up front.
Yes.
That for me is
I
the
like
big,
that.
big
Yeah.
piece here.
Yeah, I don't have a problem. That's what they've done. Yeah, I like the initial piece added to it.
Okay, great. Strong
Are
hold.
you all right?
Oh, good.
You're gonna ask Ann to. Okay.
And I will clean up this markup for you so that it reads.
Oh, the language justice. Bill. Okay. So we're good, Jen, I'm just gonna work from the calendar and just talk, I don't think if there are questions, Dave, we'll be fine.
Yeah, that's fine. I'm just going to clean this up and resend to Calista so that the markup version is a little bit more accurate for anybody who might be going online looking at it.
Okay. So we're gonna call it a wrap and go off live, and we do have a couple other confirmations. I'll be bringing at least one in next week.